Hello, my name is Jim Bemister and I'm a respiratory therapist. I just want to do a quick demo and discussion of high-flow nasal cannula. So I have two examples here. This is the high-flow nasal cannula that's designed for high liter flow with heat and humidity. It's tolerated very well in patients. You need a special device to deliver it, but this is basically the nasal prongs that the patient would wear. It would just sit in the nose like that, and then it would connect to a device that's able to deliver that. Now, they've discovered the advantage of high-flow nasal cannula is actually very good as far as keeping people oxygen saturation up during the process of intubation. And what we've also discovered is that just with regular nasal cannula, which is, this is an example of, if you had regular nasal cannula on, the patient would not be able to tolerate really high flow if they were conscious and spontaneously breathing, like they would if they were wearing the proper high flow nasal cannula. But what we realize now is that once you've sedated them and or paralyzed them in preparation for intubation, at that point you can turn the flow up on these cannula to the same level that you would on this one. This one would be tolerated on a conscious patient quite well. High flow in this case, in the low flow device, wouldn't be tolerated very well, but once they're sedated, just for a short term, you could actually turn the flow up very high. So these larger ones typically run at 50, 55 liters per minute. The low flow ones are usually maxed out at 6 liters a minute, but once the patient is sedated, you could actually turn that up to 50 or 60 liters a minute, which would help you to ensure that they maintain their oxygenation while you were doing the procedure of intubating them or whatever airway procedure you were doing while they were sedated.